Hello and welcome, a very warm welcome to everyone joining this webinar on sensory processing and Fragile X. This webinar is for families and carers of people of all ages who have Fragile X syndrome, as well as support workers, residential care workers, staff in specialised work environments, daycare staff and educators. My name is Liz Jewell and I work as the Family Support Counsellor with Fragile X Association Australia. Before we begin proceedings, I would like to acknowledge the traditional owners of this land and all the lands on which we are meeting today, and pay my respects to elders past, present and emerging. The question and answer segment will not be recorded. An acronym I learned today was AQUAROC, which stands for all questions you ask are okay. And so to our presenter and tonight's webinar, Bev Kadish is an occupational therapist. Bev specialises in sensory integration and neurodevelopmental therapy and has more than 25 years experience. Bev's special interests include sensory processing disorders and school readiness. In tonight's webinar, Bev will give an overview of what sensory processing is, how some individuals with Fragile X experience sensory processing disorders, as well as some strategies that will help the individual with Fragile X. Without further ado, I welcome Bev.
Thank you so much, Liz. I think it's really exciting for me to be presenting on sensory processing. It's something that I work with every single day. It's my passion, and I really have made such a difference in so many people's lives that it is exciting for me to work with these individuals. I think in terms of Fragile X, sensory processing is always an issue. We often see undesirable behaviours, and many of these can be attributed to sensory processing disorders. So I'm just going to talk a little bit about what sensory processing is in general. We all take in information through all our senses, and how we translate that sensory information into action is called sensory processing. It's a complex neurological process. It influences the actions or the behaviours of individuals, and everybody processes sensory information from conception throughout our lives, every minute of every single day, and it affects every aspect of our lives. So sensory processing is the body's ability to receive or take in sensory stimuli, interpret the stimuli, process the stimuli into a response, and then to adaptively respond to the stimuli. And I think that is where this sort of is broken, is in the processing of the stimuli into an adaptive response. And with Fragile X, they always have amazing memories. And if they have a memory of some sensory experience being unpleasant for them, they then start to avoid those things. And we get something called approach avoidance, where they actually start refusing to partake and they don't want to be involved in certain things because they remember it as a negative or a bad experience. So when we look at sensory processing, we take in information from our 5 senses: sight, sound, taste, touch, and smell, as well as the 3 hidden senses. And these are proprioception, which is body awareness, the vestibular system, which makes us aware of our body's movements, and interoception, information from our organs. For most people, sensory processing occurs unconsciously, and it helps us to develop a concept of ourselves in time and space. If we think where each of us are now and what sensory information is coming into our bodies right now, you're all hearing me on an auditory level, you're seeing me on a visual level, and then you're also getting proprioceptive input. And that proprioceptive input would be the position you're sitting on your chair or lying on your bed or beanbag. If that surface is hard or soft, if your knees are bent, if your legs are straightened, that is all information that we don't even think about, and we just process this subconsciously all the time. With a sensory processing disorder, there's often a disturbance somewhere there, and that information does not come through to the brain and give us the information that we need in the correct manner. So when we look at sensory processing and how it works, you can see over here that the first one is just actually taking in that information, then making sense of the information, and then actually having an output which is appropriate to the input. So this is the pyramid of learning, and the pyramid of learning as an occupational therapist is one of my favorite slides. What it shows us here is the importance of the sensory system and how this affects every single thing that a person's life involves. So we have all the different sensations at the bottom, the tactile, the vestibular, the proprioceptive, gustatory, auditory, visual, and olfactory. And they're all providing our body with information all the time, both from within and from without. And this influences how the rest of our system functions. So this pyramid of learning shows how the sensory input supports even the highest level of functioning right at the top, which is the academic learning. We have those base systems, and the information derived from those base sensory systems affects our motor output. So it underlies all skill development in both gross motor and fine motor skills. On the next level up, it affects all our speech and communication, social interactions, and formation of relationships. And then the final level, the cognitive level or the intellectual level, is an ability to take care of ourselves, performing all daily living tasks, emotional development, behavior, and then at the pinnacle of this pyramid, academic success. When we look at the way sensory information is processed, it's very different for everybody. So you and I are processing, every single person on the Zoom is processing sensory information in a slightly different way. We all have our sensory preferences and things we like, and sensory dislikes or things that we'd rather avoid and not engage in, whether this be tastes, sounds, smells, some visual input, or having our body in certain positions. Some people might love lying upside down in a hammock, for instance, and other people might find it awful. Some enjoy doing things such as somersaults, and other people find it really something they don't enjoy and cannot tolerate and would prefer to avoid. So there are things called sensory preferences, and that is what makes us all individuals and what gives us our personalities and our body awareness too. When we look at sensory processing, I would say that sensory preferences and things that we try to avoid are normal. But where does this become a problem? And I think we have to look at the fact that it becomes a problem when it starts to interfere with one's daily life. So if your sensory preferences become so strong that you are almost obsessed with them and you keep engaging in repetitive behaviors to get those sensory needs met, that is an issue. And on the same spectrum, we go to the other side where if everybody is avoiding things, then that becomes an issue as well. So we need to look at what is a sensory processing difficulty then. And individuals with Fragile X syndrome all have sensory processing difficulties of one description or another. So it becomes quite difficult. Everybody, of course, is an individual. I'm not going to group and say everybody has the same sensory processing difficulties. Obviously, we have to look at the individual, see what their difficulties are, but it's really a problem where the brain is receiving information and the way in which that information is interpreted on a neurological level is interfering with the individual's functioning, whether it be at school, at work, at home, within the family unit, with their peers. There is something that is not quite right and it's affecting their functioning. When we have a look at this slide, this sort of is a great picture of what a sensory processing disorder is. And all of these are typical of individuals with Fragile X. So they may not like bright lights. They can be hypersensitive to loud noises. They don't like having their hair or teeth brushed. And I can see some parents nodding over here, but everybody can sort of identify with one or another of these behaviors. Sometimes they don't like to be touched, but they'll touch you as much as they want to, when and where they want to, sort of thing. They may crave certain things like spinning or movement. because they need more of that spinning or movement to satisfy their sensory needs, because their body is not processing that it's getting that spinning or movement. So they just have to keep repeating and repeating and repeating it for their body to actually feel satisfied. And we refer to this sometimes as filling their sensory bucket. So making sure that they're getting exactly what they need. Then they also may absolutely go hysterical when they get the most minor scrape or cut or burn or something, because they are so hypersensitive to pain or temperature. They don't want their hands dirty. They're avoiding any activities where they even may get slightly dirty. And some children won't even use things like hand soap, because to them that is really not a pleasant sensation. The other difficulty is with things like tags on clothing. We might all be aware when we put on a new item of clothing that there's a tag at the back, which is just annoying us a little. And then we tend to forget about it in a few minutes. Individuals with Fragile X often have difficulty habituating, which means that they are constantly feeling that annoying tag. They cannot sort of turn off to it once that initial sensation has passed. And because that annoying tag is annoying them all the time, they actually can't learn what the teacher is teaching or listen to the parents as to what you are saying or asking them to do. So this is how sensory processing interferes with their daily functioning. So there are two primary categories of sensory processing that affects Fragile X individuals. The first one is sensory discrimination, and the second one is sensory modulation. Now, sensory discrimination is poor processing of sensory or motor information for skilled response. And this type of sensory processing disorder results in poor coordination, dyspraxia, motor planning problems, and we typically see difficulties with gross motor skills like running, climbing, jumping, hopping, and then also fine motor skills such as threading, drawing, using scissors, using cutlery to eat, writing difficulties, and low muscle tone. And the second type of sensory difficulty is called sensory modulation. And this is the manner in which the sensory information is interpreted in the brain for things such as arousal, alertness, attention, organization, coping, adaptation, and self-regulation. And what we typically see here is very high levels of energy. I've seen this particularly with young children with Fragile X, where they are sort of running around the room frenetically. Concentration span is literally 1 or 2 minutes at most, and they actually can't sit down to enjoy a meal. Getting them dressed is quite a chore because they are running around all the time, and it really becomes difficult to manage these children. They also are not able to learn well because they just can't pay attention, and they have a lot of difficulty coping in group settings in particular because the environment becomes so busy for them, and they just get even more stimulated, and their regulation and their arousal levels just go up, and they just can't actually do anything meaningful and purposeful. So when we think about the sensory system, we are constantly bombarded with sensory stimuli. There are things going on around us all the time. For you and I right now, as I said, there's auditory input, there's visual input, there's proprioceptive input. In certain people's houses, there might be heating or cooling on. In Sydney, there may be the rain outside, and you and I can habituate to those things. We can tune out, we can ignore those things. For the poor individual with sensory processing difficulties, it's like everything's hitting them at once. It's too loud, it's too bright, it's too fast. There is just too much going on. And they therefore find it really challenging to participate and to actually complete things successfully because there's just too much going on in their world, and they can't filter out what is sort of irrelevant and what they need to attend to right now. There are a lot of auditory difficulties with Fragile X, and the main one is that they can't habituate or tune out to those background noises, and they also tend to be hypersensitive to sound. So I actually have my practice on a road where there is a tram. I don't even notice the tram. And there are certain children that I actually can't see in the front room of my practice, because every tram that comes past, we have a police station up the road. So every police car that is sort of within a 1K radius of us, they hear all those things. And it's like, stop, listen, what's going on? And they can't actually focus on the therapy session. So that is sort of how their level of hypersensitivity is affecting them. We know that there's also a lot of visuospatial impairments. They cannot cope with bright light. They cannot manage when there are flickering lights. They often don't like bright sunshine. They like to cover their eyes, sometimes wearing sunnies. One of the things I remember from my first Fragile X conference was the number of males wearing caps. Almost all the attendees with Fragile X were wearing caps. And that was sort of, hey, not only is it gaze avoidance so that they don't have to look at people and they feel more comfortable, but it also sort of blocks out all that visual stimuli of all these people around you. It gives you almost a sheltered view of the world, and it also blocks out very bright lights. So that is an amazing coping strategy that they use, wearing a cap to get rid of that hypersensitivity to visual stimuli. Then we have the tactile defensiveness. And tactile defensiveness affects most individuals with Fragile X. They don't like getting messy. They don't like the feeling of certain clothing and labels and tags. And they don't eat certain foods because they can't tolerate what those foods actually feel like in their mouths. They also seem to have a larger personal space, and they don't like other people getting into their personal space or being too close to them. And if they do, boy, oh boy, sometimes, you know, they will lash out, and that's when we see behaviors that we think, this is not typical of them, but sometimes it's just that the environment is too busy and they cannot manage that. So hyperarousal is a word that I frequently use when discussing Fragile X individuals. They have a higher baseline arousal. They are constantly on guard, and they are way more sensitive to environmental stimulation, which leads them to become hyperaroused. So hyperarousal can be triggered by noises, new environments, unfamiliar environments, people being in their sort of personal space, forcing eye contact, or any situation which is unfamiliar and in which they feel uncomfortable. Hyperarousal is actually a neurological, physiological state which causes increased blood to the muscles, increased heart rate, raised blood pressure, more rapid breathing, sweaty palms, pupil dilatation, and reddening of the face and ears. Sometimes you can actually see this hyperarousal if you know what your individual does in those situations, and it directly affects the individual's behavior. They start to act very impulsively. You cannot rationalize with them. Sometimes we see swearing, outbursts of anger and aggression when they're generally very loving, calm, gentle people. Sometimes speech or language totally evades them. So while they might be verbal, at the times when they become hyperaroused, they actually just cannot find words. They cannot actually listen to you. And they start to display a lot of disorganized, repetitive behavior. So here we might see perseveration, where they go and they want to get the words out, but they just can't get them out. Or otherwise stimming type of behaviors where they start using their hands to stim, or they start tapping with hands or feet. I've had quite a few, particularly young individuals who, and particularly the non-verbals, who have started biting, and they tend to bite on the thumb of their hand. So anytime they get hyperaroused, their sort of way to try and calm themselves is biting their hands. Sometimes they bite parents, which we've seen a fair bit of, and they actually might become quite aggressive. And I think this is a particular problem with larger adult males, because it's quite scary when they suddenly turn on you and people are going, but there was no reason. They just turned from like hero, and there was like no warning that this was going to happen. I don't know why it happened. And when we look, we often find that there was some environmental stimulus that they couldn't cope. Their processing is not what everybody else's is, and they became hyperaroused, and that led to their aggressive behavior. And then they also sometimes have self-injurious behavior where they actually scratch themselves, bite themselves, lash out, or just start knocking themselves against things, which is also sometimes another stimming behavior. And this is their way to try and regulate and try and restore some feeling of being in control for them. I'm going to quote our lovely Marsha Braden, who is the psychologist who has done some of the Fragile X talks for the Fragile X Association. And what she always says is we need to look at the ABC of behavior. So we need to look at the antecedent. What is causing that behavior? We need to look at the behavior itself, and then we need to have a consequence. And very often we need to look and find what that antecedent is, what is causing that behavior. And if we can identify that source of that hyperarousal, then we can change that either by changing the environment, preventing exposure to certain things, being more aware of certain situations, or removing the individual from that overstimulating environment, which is then not going to result in those undesirable behaviors. And it's really important that we don't think, hey, they're behaving badly, we've now got to have consequences for this behavior, or we've got to change the behavior. We often need to look at what is preceding that behavior and how can we change that, because we know that their sensory processing is not neurologically the same as everybody else's sensory processing. So those sensory stimuli actually become offensive and just totally overpowering to them. And that is why we are getting those resultant behaviors. So I'm going to discuss a little bit about sensory integration therapy. This is a modality of therapy which is evidence-based and has been found to be the most effective way of dealing with a sensory processing disorder. It's a specific frame of reference that is used by occupational therapists. It is based on the work of Jean Ayres, and it uses a sensory motor gym to actually effect change in the individual's neurological system. So I always say to parents, I only have a sensory gym that caters for younger children, so under 12s. And I say to parents, it's not a quick fix. They're not going to come for 3 therapy sessions and be fixed, because that's not the way it works. Excuse me. I generally see people once a week for therapy. And I often say it's about an 18-month process to actually change the way that that nervous system is processing that sensory information to have appropriate adaptive responses. Some therapists do therapy intensives. There's an amazing center in America, which I hope to visit soon, called the Star Center. They see children 3 to 5 times per week for therapy. Their average time to effect change is between 3 and 6 months. So obviously it's a lot more intensive. It works a lot quicker. And this is an ongoing life change. Their sensory system is forever changed. And I've had parents coming to me with things like, he refused to wear any clothing before. He was only wearing those same 2 outfits. I had to buy him the exact same clothes all the time. He wouldn't wear anything else. And after a period of sensory integration therapy, they're like, hey, he's wearing long sleeves for the first time. He's wearing jeans. He's wearing a whole variety of clothes that I never imagined he would wear, but that is what is happening. They're also then saying to me things like, my child is crying when he experiences pain. He's never cried because his sensory system wasn't registering that pain properly before. So it wasn't interpreting that painful stimulus as being an issue. But now, when he hurts himself, he's actually crying, which is what we expect of a child that age. So in the sensory integration therapy, the OT guides the child through lots of fun but challenging situations with lots of sensory input, lots of movement opportunities, balance, and we basically try and challenge the child, but make sure that they achieve success with every single thing we do. So the main thing for the younger children that this helps to achieve is it achieves a sense of regulation. So they're actually able to sit down, concentrate, focus, and they just have a sense of calm so that they can attend, learn, develop relationships. Most centers that I know don't practice true Ayres sensory integration in the way that it was originally intended. We use various other techniques, such as floor time, the Early Start Denver model, and there are various different other modalities that we include in our treatment protocols. But what we're really relying on is the neuroplasticity of the brain and the ability to change the way the brain interprets that sensory information so that it is responding more appropriately. Now, this whole concept of sensory integration, as I said, comes from Gene Ayers, who was an American who developed this whole concept. There are a lot of Americans trained in using this modality of therapy. Unfortunately, not a lot of OTs are trained in this speciality in Australia, and it is quite widely practiced in Europe, a few other places in the world, but hopefully we can get more OTs on board and we can get more of them trained, because it is a very powerful treatment modality for those with Fragile X. We often use a sensory diet in conjunction with the sensory integration therapy. And what a sensory diet is it's giving the individual input throughout the day to help them stay regulated and calm. And in the same way that you eat meals for a nutritional diet, breakfast, lunch, and dinner, there are various intervals that we should have sensory input into our bodies for these people. And that would be the morning, midday, and the evening. And then we often have sensory snacks, which are sort of little top-ups, which aren't as much as the actual, what we call sensory meals. And they're just for very short periods of time. So when we look at the sensory diet, we look at providing very specific activities, usually whole body activities, which provide lots of sensory input to the individual to help them stay focused and organized throughout the day. And it's the job of your occupational therapist to work out which activities will work for your individual with Fragile X, bearing in mind that certain activities, just the way they are done, can either be stimulatory, so they can rev up somebody's system when they're in an almost sleep-like state, or they can calm somebody down when they're running around the room. So an example of this is swinging. If somebody is doing slow rhythmic swinging, that is gently calming. If somebody is doing fast, erratic, irregular swinging, then that is providing very intense sensory input, but it is often stimulatory. So the therapist needs to decide what kind of activities you require at which times of the day. Obviously, we are trying to give much more sensory input in the mornings and the afternoons, whereas in the evenings, although we want to give sensory input, we'd be using more calming sensory input in preparation for bed and things like that. Now, I just have to be very clear that a sensory diet is something that is done every day, and it's not going to change the way that the individual processes sensory information. What the sensory diet is it helps to fill the individual sensory bucket so they're getting the sensory input that their body needs, but it is not going to change levels of hypersensitivity to sound, to touch, to taste, or any of those things. So it is really a strategy, but it is not going to affect long-term change. It's more about coping with the present situation and dealing with the here and now of each day as it unfolds. There are various other things we can use to help the individual cope with their daily expectations. And we know that deep pressure or proprioception is very calming. We can use things like a weighted backpack. So just putting a backpack on somebody with Fragile X, especially during transitions, which can be potentially threatening and stressful, just helps to provide some calming. There are things like compression vests, weighted vests, body socks, weighted lap bags, weighted animals. And then to assist with sleep, things like weighted blankets or compression sheets also help to provide deep pressure. Then things that you can give to that individual and things that support workers can really use are massage, pressing down through the body, just using your own body weight through the shoulders, rubbing the back, making a body sandwich. So a body sandwich is where we put something under the individual and something on top of them. And just that deep pressure on both sides of their body while they're lying down tends to be very calming. Sometimes this can just be a mat, a heavy doona, a bean bag, something like that. And then something that I find really useful is the TheraPressure technique or the Wilgard-Barger protocol, which is using a small brush, which is calming, and particularly when they're in a state of hyperarousal, sometimes it's useful just to apply this technique, and you'll just need to find a therapist who is qualified to teach you how to actually do it. On an auditory level, what we can do to try and protect them almost from all these sounds, too many, too intense, is wear sensory ear defenders, as this young guy's wearing here, use ear pods. Sometimes calming music is also helpful. So when there's a lot of sensory stimulation going on, just putting on headphones and listening to calming music and then singing. And I don't think anyone should ever underestimate the power of their own voice. You may sometimes think, well, what sensory tools do I have with me? You've always got your voice with you. So you can just sing to them, very gentle, calm, lullaby type things are really, really calming and soothing for them. The other thing which we can do on an auditory level is just be aware of background noises and try and eliminate those background noises. Just remember that you might function okay with the TV on in the background, with music playing in the background, but for your individual with Fragile X, this may be quite challenging. And if you can just limit the number of background noises, it can just make it easier for them to attend, focus, and do what they need to do. Visually, as I said before, we can wear caps, we can wear sunglasses, but to actually calm the visual system down, something like lava lamps, where it's just a slow rhythmic pattern that they're observing, or the oil and water distractors seen here, pendulums, these are all really calming, really gentle, and just make them feel more in control. Tactile. This is one where lots of parents are trying lots of different things. There are so many different things available on the market from a tactile perspective. The first one I'm going to talk about is pillows, and there are some beautiful vibrating pillows out there where I've had an individual with Fragile X who needed to catch public transport. This was a real challenge for him. It was literally a tram from point A to point B. But he found that having a vibrating pillow in his weighted backpack, which gave him pressure against his back and sort of gave him almost a massage feeling, was really comforting for him. Sometimes when your individual goes into a state of hyperarousal, just using that pillow can also be very useful. Just collapsing into a large beanbag or a pod and just having that pressure around the body is also sometimes comforting and calming. Then we have fidget toys, and there's a huge variety of fidget toys available. Sometimes individuals find things just like a hair elastic, a piece of ribbon, a label to be a great fidget toy for them. So it's really a case of there isn't one recipe for all. You've got to just work out which fidget toys work for them. Do they need something where they're pulling it apart? Do they need something where they're squeezing it and pushing it together? How much pressure? Do they prefer a click type thing or a swish type thing? There's just so many things to think about and to try. Other things are kinetic sand, Play-Doh, and these are all very calming and regulating. And I cannot think of the other one we sometimes use. It's those little flower beads, and I will think of the name and let you know. Otherwise, Emily, you're going to help me out later and let me know what it's called. The next one is the oral system. And here, a lot of people have chewy pendants, jewelry. There are so many different chewies that one can use. And we have to see that this is in preference to the individual biting their hand or lashing out or scratching others, just having that as a calming tool. We can also see on the diagram there, the pencil toppers, which are really useful, and they really withstand quite a lot of pressure. And then we talk about a bob, or a biting options box. Orbeez, thank you, Emily. I knew you had come to my rescue. So those Orbeez are those water beads, which a lot of the Fragile X individuals just love putting their hands in and just raking their fingers through, and they are super, super calming. Things in the biting options box are usually crunchy snacks, things like carrots, jerky, biltong, pretzels, crackers, anything that gives a lot of crunch and a lot of pressure through the jaw, corn thins, chewing gum, things like that. Then the other oral things which we sometimes use are things which we blow, which are whistles or bubbles, or sucking through a straw. And the blowing and the sucking often help with deep breathing. So when somebody's feeling hyper-aroused or just not coping with sensory stimulation, deep breathing is often a helpful technique, and you can sometimes use blowing or sucking tools to also help achieve deeper breathing. Sometimes if you say to them, you need to breathe deeply, they just simply cannot do it. You actually need to sit opposite them and breathe in and out, in and out. Sometimes a breathing card may help, and then using a blowing or sucking tool. Olfactory is really not a sense that we use a lot with calming. I think it's quite an underused sense. Olfactory is actually our strongest sense in terms of memory. So they are often very hypersensitive to smells, and these smells make them avoid certain places because they associate certain memories with certain smells, and they can find smells very overpowering when we hardly even notice smells. So just to be aware, myself as a therapist, I never wear perfume to work, and I wear a very muted deodorant because I know that the individuals I work with just do not cope with these smells, and they sometimes find them noxious. But in terms of calming, sometimes a familiar smell, because it's also memory-based, is very calming, and they actually enjoy these things. So mum or dad or a caregiver or a special person's perfume or deodorant can be calming to them. Lavender sachets and just using calming aromatherapy oils can be useful, just to have them in a room if that is something that they like. And if it's something that they don't find overpowering, remember, we don't want too many different sensory things going on, because that goes sensory overload and hyperarousal. Then we often talk about an emergency backpack. And what this emergency backpack is a backpack that should go with you wherever you go, whether it's in the car, whether it's to a day placement, to school, on an outing, family visits, and it just has a lot of sensory tools in it. And it has tools that work for that individual in different situations. You can also put things like sunnies for bright lights, sensory ear defenders for noisy environments, chewies in your bob box, crunchy snacks there, fidget toys, whatever. They need to stay regulated in the calm in a crowded environment. And I think one of our families has a slide to share. So Darren, I'm going to put it over to you if you want to tell us a little bit about it.
That was amazing. Thank you, taking us through that. And I was nodding the whole time because just about everything you said was kind of the experience that we went through with our youngest daughter, who's now 8, Alana. She's got Fragile X, and you were on the money as far as, you know, the time it took. She used to find so many things. That the feel of the tags was the exact one she hated. We had to cut them off her singlet. It took her a long time before she'd walk on grass and all that sort of things. And what happened over the years working with a really good therapist like yourself was she'd come back from her therapy sessions and there'd be a new one of almost all those things that you were mentioning in the backpack there, like the stress balls, the fidget cubes, the chew toys, love the octopuses. The essential oil was an amazing one. She was always feeling very nervous when she first started school, and the amazing lady that the therapist was working with it just started with, it's just the lavender oil, as you mentioned. So our older daughter Abby, who hasn't got Fragile X, but she's on the spectrum, sort of built up this handbag that she would take with her to school every day with pretty much all these items that you can see here on the slide there. And then interestingly, Abby came home one day on a Thursday or Friday, and she said, 3 of my friends at school want to borrow we were calling them pocket packs at the time. So my wife and our younger daughter Alana spent the weekend hand stitching some handbags together and putting some things together. And we just thought it'd be a good opportunity to actually get some made. So we've got some of these made, as you can see here on the slide. And we're just working with the amazing people at Fragile X and starting to work with some of the schools and sharing them around. And so far, people are loving them. So thank you for this opportunity just to show you. If you guys are interested in them at all, have a look at coolkits.com.au. We are putting money towards further research. My main thing, as a parent, was just amazing. And it was very heartwarming that when Abby did this, it was help these other kids. So yes, just having that reaffirmed in that presentation was just amazing, and appreciate it if you guys want to have a look at the cool kits and give us some feedback. I certainly got some more great ideas out of that presentation, so thank you. We'll continue to evolve them, and let us know if anyone's got any interest in them.
Thanks, Darren. It's amazing because I think that every single person with Fragile X needs one of these backpacks. And I just think that having one available with all those tools available is so valuable. And sometimes when they become dysregulated, they can't think what they need, but just to have that backpack available that they can look inside the backpack and choose items is really, really helpful to them. And that just helps them to regulate. The next thing I'm going to talk about is the environmental adaptations. And these are things that some of you may have thought about, some of you may not have thought about, but you can make changes in order to make the environment less threatening and more easy for your individual to manage. So what I'm going to ask you to all become is little detectives and walk around your environment and start to identify things that might be causing your individual to become dysregulated or hyperaroused. I want you to start noticing signs. I know one of the children I see, his ears go bright red, and they don't always, but this particular boy's ears start going bright red, and to me that is a sign he's becoming dysregulated. I need to bring in some calming strategies straight away. Sometimes you'll notice changes in their breathing. There is another lovely boy, I don't think his parents are on here tonight, who is one of the most charming, gorgeous individuals I've ever met, and everyone at my reception thinks he is the best kid ever. But I can assure you, when he becomes dysregulated, he has bitten me, he has scratched me, he has pinched me, and it's usually preceded by a little bit of swearing. So now that I know that, the minute he starts swearing, I can avoid that biting, pinching, and scratching by just regulating him straight away and just taking away all demands and just totally reducing any sensory input that he's given. I've also learned to do certain things, like the minute he walks into the room, I have to know that there is no heating or cooling on, because that is a trigger for him. So just try and notice things around your home or in the environments in which you find yourself that may be causing sensory overload. Another one which I found when I went to another young man's house was his mum had been amazing. She decided that there was way too much visual clutter and he was getting overloaded from all the visual clutter. So she removed all the visual clutter and had a pretty bare environment, and that was great. And she took all the stuff out of his room. The only problem was they had floorboards, and unfortunately, when there was no soft furnishings in his room and nothing else in his room, everything was echoing and vibrating, and she couldn't work out. She had removed all this visual clutter why he was still going into a state of overload. So things like that. The lights overhead may be too bright for them. Sometimes they only cope with dimmer lights. They often prefer to be in dimmer, darker rooms rather than really illuminated rooms. Smells are another one. I know candles are in fashion. I love them myself, but sometimes our individuals with Fragile X can only cope with certain scents, or they may not be able to cope with scents and other sensory stimuli at the same time. So just to be aware of that. And just remember that when an individual goes into sensory overload, they actually can't listen to you and what you're telling them. You need to just give them strategies and tools straight away to help them calm themselves down, and then talk to them afterwards. And I think one of the most powerful strategies we can use is co-regulation, where you just don't get phased. You've got to stay as calm as you can be, talk in a slow, gentle voice, sing to them, and try and get them to regulate on the same level as you, because their regulation is sky high and we need to bring it down. And obviously just to remove them from whatever stimuli are causing that, or stop or remove the stimuli if possible, if that is what you can do. And just think what sensory calmers have worked in other similar situations and try and give it to them, try and encourage them to use it. Because when they go into hyperarousal, they actually can't think for themselves. Their memories are often blocked. That autonomic nervous system is in total overload, and they're just not functioning to the best of their abilities. So there is help out there. There are a lot of strategies. I hope I've given you guys a lot of food for thought.
Well, Bev, We really can't thank you enough for giving such a rich and valuable presentation. I love that we record these webinars because it allows us all to go and revisit the very experienced knowledge and information that you've shared this evening. So thank you enormously. Just a reminder to everyone that Bev will be running a separate webinar on the 31st of May, which will be specifically for therapists. And that webinar will focus on the creation of sensory diets and how sensory integration therapy can help with sensory processing disorders and Fragile X syndrome. So we get to have you again, which is fantastic.
Thank you for having me. As I say, this is my passion and this is really what I do enjoy doing, and just sharing my knowledge and helping as many families as possible.
Oh, well, we're forever grateful that we have individuals such as you available to us. So thank you enormously.
And I look forward to seeing many of your OTs next week online.
Yes, yeah. Yes, please, spread the word to OTs and speech therapists, physiotherapists, anyone who may have an interest in joining. And just before we end, the Fragile X Association is looking for some feedback on online support program, including the webinar series and online Zoom peer support groups, as well as the Fragile X Association Facebook discussion groups. The University of Melbourne will be facilitating interviews from people who've had involvement in any of these programs and provide feedback anonymously to help us improve or change the format to better support the Fragile X community. The interviews will be conducted by phone or Zoom with a researcher from the university, and they'll last around 30 minutes. An invitation to participants in this study will be sent to everyone who's registered for tonight's webinar, and also promoted via the Facebook Association website and social media channels. We really welcome your feedback and hope that you'll take part. Thanks so much, everyone, for joining us again this evening.